Hi, my name is Jennifer Pomeranz. I'm a public health lawyer and assistant professor at the School of Global Public Health at NYU. I'll be giving a quick overview of state preemption of local policymaking, a topic that I research a great deal. So preemption, and what we're talking about here today is sometimes called ceiling preemption, is when the state removes the authority for local governments to act. Another term that should not be confused with preemption is floor preemption, or actually minimum standards. These are not preemption, and this is when the state provides baseline standards that allow local governments to engage in policymaking to improve upon or add to these standards. The Civil Rights Act, the Federal Civil Rights Act, is one of these and allows states to provide additional protections not afforded by federal law. And another term just on this topic is called a savings clause, and this is when a state expressly reserves local authority to engage in policy making on the specific topic. And sometimes this is paired with minimum standards, and sometimes it's just an express grant of authority to local governments to engage in policy making on that topic. So what we're seeing is a great deal of preemption across the country. This is a concern for public health lawyers and public health practitioners and stakeholders because often local officials are closest to their community members. They know their constituents, they know what their needs and values are. And the constituents have voted in these local officials for the reason to have them engage in representative democracy and engage in policymaking that's responsive to the needs and values of their community. There's a real concern that when local governments are not able to engage in policymaking, they can't address local issues, and the state governments often cannot or do not address specific issues that are of concern to local communities. And also, local governments are historically innovative, and they sometimes come up with great policy solutions that can't be just tried out at a state or federal level. So state preemption shuts down all of these values. Just as a quick showing of a study, there was a survey of mayors and health officials of large U.S. cities, and they responded that the vast majority of them said that preemption is an obstacle to the local policy making, and they listed 22 public health issues that they were unable to engage in policy making for. Some of these issues that we are seeing across the country are tobacco, alcohol, ban the box, food and nutrition policy, minimum wage, gun safety and gun control measures, LGBTQ civil rights, especially plastic bag ordinances, fire safety rules, CAFOs or animal feeding operations, and also fracking, paid sick leave, and then of course COVID. We are seeing state preemption over local government's control over all of these topics and additional ones as well. So some quick overviews. These are maps from 2018, but it does give you an idea of where we're seeing state preemption. This is for automatic fire sprinklers. I mean, something that's not really a controversial issue, but the building organizations were able to get state preemption across the country for the requirements of fire sprinklers in these states. Here's state preemption of paid sick day laws, state preemption of food and nutrition policy laws, and then the biggest are state preemption of fire safety laws, which is in almost all of the states. So how is preemption getting passed? There are a few topics and tactics that the industry and the state legislators are using. So industry members are funding state legislators' campaign. They're providing a lot of money to get preemption passed. They create model legislation, and then they have backdoor meetings. This is an example in California of a secret meeting before the state preempted local soda taxes. They're also engaging in misleading frameworks to the public. Yes to affordable groceries actually means preempting soda taxes. They are using front groups and astroturfing, which is a funny term for fake grassroots movements. And then what are state legislators doing? I engaged in a study with a colleague of firearms, paid sick leave, food and nutrition policy, tobacco and civil rights preemption from 2014 to 2018. And we found that state legislators are engaging in 5 methods to pass or support preemption that might not be obvious to the public and especially their constituents. They're passing preemption quickly. The majority of these quick passage laws were passed within the same day on both houses of their state legislator. So the same day it went from one house to the other and passed. 1 to 2 days, 3 to 4 days. These are very quick passages of state laws. They were obscuring preemption by bundling topics, by including preempting multiple topics at once, which creates a need for scrambling to oppose it, and also adding preemption to totally non-related topics that are of substantive issues. These often violate state single subject rules, but there's really no recourse unless there's a lawsuit, which doesn't happen very frequently. And courts also have a hard time interpreting single subject rules. And I suppose that this is kind of well known, and that's why these bills pass, even though they violate state single subject rules. There was a case of a state that repealed preemption and made a big deal of it in the press, but then actually replaced it with an identical preemptive clause. They preempt litigation, which means that states are providing immunity to select industries. We've seen this across the country for the firearm industry and also the restaurant industries. They preempt the ability of lawsuits, which can bring to light some specific issues that can also lead to policymaking, which is maybe one of the reasons that these laws are providing such immunity. And then lastly, they're engaging in punitive preemption, which in the context of firearms allows people and also organizations to sue local officials and local governments, and they can be fined or even removed from office if they engage in activities that the state deems preempted. So what are some lessons for us? The advocates, practitioners, and stakeholders, we must make anti-public health preemption part and parcel to our pro-public health activity. This is true not only in public health, but for all policy activity. We must be fighting preemption at the same extent that we're fighting for the policies that we care about. This includes unifying non-traditional allies and also traditional allies and partners against preemption. Local officials should be transparent with their constituents. Let them know what's going on. People don't know that preemption is an issue. They don't know what preemption is. It's an unfortunate term. But also leverage your relationships with state officials. They need you when they're campaigning in your local jurisdiction. You don't have to help them out if they're constantly taking away your ability to do your job. And lastly, state officials, you who actually do support local policymaking, you can include savings clauses in your legislation and also leverage your relationships with local officials and support them across to engage in policymaking that actually supports the members of your state and not just the views of certain legislators. Thank you so much. Please feel free to contact me if you have an interest, and here's my email address. Thank you.